Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a bit of a nuanced video. I had to do some digging for one of my patients to try to figure out an alternative for certain therapy for her because she's just very sensitive to certain things. And so I put in a decent amount of elbow grease looking into this research, and so I thought I'd post a video about this in case there's other folks out there who are dealing with this more nuanced type of situation. In my practice, I work with primarily patients dealing with complex chronic illness, and with that comes a lot of folks who are very, very sensitive to certain things. So, and I'm very happy to dig into the literature or look for other options or talk to other colleagues or whatnot to try to figure out good alternatives because there's no, well, and there are very few one-size-fits-all solutions for many things in life, and for folks dealing with complex chronic illness with sensitivities to boot, nothing could be truer of that patient population. So the challenge we were running into is that I was working with a patient who has low stomach acid, or hypochlorhydria is the technical term for that. And the typical thing that can be used to help address hypochlorhydria is supplementing with supplemental stomach acid. And that typically comes in the form of something called betaine hydrochloride. Just as a general disclaimer, nothing that I have said up to this point or anything that I will say into the future should be constituted as medical advice. Please talk about any health concerns that you have with your personal health authority, and certainly don't pursue any treatments without first talking to your personal health authority. So with all of that being said, the challenge so what is typically done is working with something called betaine hydrochloride. Now, the other name for betaine is trimethylglycine. And for anyone listening who has heard of something called the methylation cycle, trimethylglycine is part of that methylation cycle. Methyl groups are incredibly biochemically simple. It's a carbon atom with 3 hydrogen atoms attached to it. That's what a methyl group is. And even though it's very biochemically simple, they're incredibly important molecules. They basically turn on and turn off certain genes. They are incredibly important for running a number of different biochemical reactions in the body. So methylation is crucially important. So beautifully simple, very, very crucial. So the challenge is that some folks who are really sick and depleted, for lack of a more eloquent way of putting it, will sometimes have a lot of issue being able to tolerate methyl groups or methyl supplements because it can upregulate all these processes in the body that get them detoxing too aggressively or working to promote, basically better function in their tissues, which is good, but better function in the tissue happening too quickly sometimes will lead to excessive detox or attempts at cellular repair or attempts at kicking, viruses or other intracellular microbes to the curb or what have you. So the long and short of it is that this patient that I was that I'm working with has low stomach acid, a lot of digestive issues, but is also very, very methyl sensitive. And so we have had a bit of a dilemma because the only product on the market that I was aware of is this betaine hydrochloride. It's like, well, I want you to have the hydrochloric acid, but I want you to, but I don't want the methyl part of it. There are other things that can be used to help address low stomach acid, like apple cider vinegar, or using bitter herbs like gentian or different formulas out there, and that's all wonderful. Unfortunately, this patient didn't tolerate any of those things, so we needed to find something else. So I dug into the literature, and I found that there's something that's been studied as an alternative or to betaine hydrochloride. I mean, they weren't necessarily seeking out to find an alternative per se, but they just found something that was also shown to help successfully address issues with low stomach acid. So for any clinicians who are listening, you can check out this PubMed ID. For anyone listening who doesn't know what PubMed is, it's basically this amazing database of virtually every scientific study that you might ever want to run into. So on PubMed, the PubMed ID or PMID is 1686581. Once again, that's 1686581. So in that article, they talk about this alternative to betaine hydrochloride, which is glutamic acid hydrochloride. And that is what the topic of that paper is all about. So I hope that this information was useful. If anybody has any questions, please just leave them in the comment section below.